There are so many values as a mother that you try to instill in your family, in particular, just being a good person, having the values of integrity and honesty. My husband and I did not set out, to raise a professional athlete. And not at any time was that the focus. It was raising responsible citizens. I'm the president of the Professional Football Players Mothers Association, comprised of moms of active and retired NFL players. The organization has continued for almost 24 years with that same mission of providing a network of resources for mothers and their families in order to help their sons be successful in their career. The Professional Football Players Mothers Association was excited to partner with the American Cancer Society because of the commitment that the American Cancer Society has made in communities of Black and brown women in particular. There are so many barriers when it comes to health care in Black and brown communities. The one that comes to mind first would be just access. And especially in this age of COVID-19, there were so many individuals left without access to healthcare providers, whether it was through loss of insurance, lack of insurance, or just fear in going to see the doctor.
One of the overarching goals of the American Cancer Society is always to address and to combat health disparities, cancer health disparities in our community. And cancer health disparities is really looking at how different populations are impacted by cancer. And there's numerous factors that really impact that. So it could be their socioeconomic factors, and that really means where a person lives, how they access care, do they have a medical home, which means a primary care provider, are they used to going to the doctor, or are they used to going to the emergency room, right? And looking at their health behaviors, right? So how healthy are they? Do they really follow our nutrition and our physical guidelines, physical activity guidelines, and looking at family history. So medical history, family history. So all of those really impact how a person is impacted by cancer. There's an urgency now to work with our health providers to ensure that both men and women from all communities, right, within the population understand that it is now safe and it's effective, of course, to come back into the healthcare system, into the facilities, to get back on their screening schedule.
My personal experience with breast cancer was 2011. My case, I was diagnosed with ductal carcinoma in situ, which is referred to as DCIS, also called stage 0 breast cancer. If I had not gotten my routine mammogram, or had skipped it, or my doctor was not as attentive, my outcomes may have been a lot different, and I may have been one of the statistics that we unfortunately know about. I know cancer screening saved my life, and this is why I share my story of my journey of early detection with all of my friends, everyone that I know, and everyone who knows me.